Most people think losing muscle strength is just part of aging, but amyotrophic lateral sclerosis, or ALS, is a progressive neurodegenerative disorder that leads to a complete loss of voluntary muscle control, while cognitive awareness is often preserved. ALS specifically targets motor neurons in the brain and spinal cord, which are responsible for initiating and controlling voluntary movements such as speaking, walking, swallowing, and breathing. As both upper and lower motor neurons gradually degenerate and die, communication between the brain and muscles is disrupted. Without these signals, muscles begin to weaken, shrink, and eventually stop functioning altogether. The term amyotrophic refers to muscle wasting, while lateral sclerosis describes the scarring and hardening of nerve pathways in the spinal cord. The exact cause of ALS remains unclear in most cases, which are classified as sporadic, but a smaller percentage are familial and linked to genetic mutations such as SOD1, C9orf72, and others. Several pathological mechanisms are believed to contribute to the disease, including oxidative stress, glutamate excitotoxicity, mitochondrial dysfunction, and abnormal protein aggregation. Early symptoms are often subtle and may include muscle weakness in the hands or feet, difficulty with fine motor skills like buttoning clothes, muscle cramps, and fasciculations, which are visible muscle twitches under the skin. Because these early signs can be mild, diagnosis is often delayed. As ALS progresses, symptoms become more widespread and significantly impact daily functioning. Patients may develop dysarthria, leading to slurred or slow speech, and dysphagia, which makes swallowing difficult and increases the risk of choking and aspiration. Because both upper and lower motor neurons are involved, a combination of clinical signs appears, including spasticity, increased muscle tone, exaggerated reflexes, and at the same time, muscle wasting and weakness. Over time, coordination becomes impaired, making walking and maintaining balance more difficult, which increases the risk of falls. One of the most serious aspects of ALS is respiratory involvement. As the diaphragm and intercostal muscles weaken, patients may experience shortness of breath, especially when lying down, fatigue, and reduced exercise tolerance. Eventually, respiratory failure becomes the leading cause of mortality. Despite the severe physical decline, sensory functions such as touch, vision, and hearing are usually preserved, meaning patients remain fully aware of their condition. This preserved awareness can lead to significant psychological distress, including anxiety, depression, and emotional lability. The disease typically progresses through stages, starting with localized weakness, advancing to widespread muscle involvement and loss of independence, and eventually leading to complete dependence on caregivers for all activities of daily living. Diagnosis of ALS is primarily clinical and requires careful evaluation to exclude other neurological disorders with similar presentations. There is no single definitive test, so physicians rely on a combination of detailed patient history, neurological examination, electromyography to detect abnormal muscle activity, and imaging studies such as MRI to rule out other conditions. Early and accurate diagnosis is important for initiating management and planning care. Although there is currently no cure for ALS, treatment focuses on slowing disease progression and improving quality of life. Medications such as Riluzole can help reduce glutamate-mediated toxicity and modestly prolong survival, while Edaravone may reduce oxidative stress and slow functional decline in some patients. However, pharmacological treatment alone is not sufficient. A multidisciplinary approach is essential. Physical therapy helps maintain muscle strength, flexibility, and joint mobility, reducing the risk of contractures and stiffness. Occupational therapy focuses on adapting daily activities and recommending assistive devices to maintain independence. Speech therapy plays a critical role in managing communication difficulties and swallowing problems, often introducing alternative communication methods as speech declines. Nutritional management is also crucial, as patients require adequate caloric intake, and feeding tube placement may be necessary to prevent malnutrition and aspiration. Comprehensive care in amyotrophic lateral sclerosis includes advanced respiratory support, which becomes increasingly important as the disease progresses. As respiratory muscles weaken, patients may experience shortness of breath, especially during exertion or while lying flat. Non-invasive ventilation, such as BiPAP, is commonly used to support breathing, particularly at night, improving oxygenation, reducing fatigue, and enhancing overall quality of life. In later stages, some patients may require more advanced interventions depending on their preferences and care goals. Regular monitoring of respiratory function through tests like forced vital capacity is essential to guide timely intervention and prevent complications. Nursing care plays a central role in maintaining safety and preventing secondary complications. Patients with ALS are at increased risk of falls due to muscle weakness and impaired mobility. So, fall prevention strategies such as removing environmental hazards using assistive devices and ensuring proper supervision are essential. Proper positioning and regular repositioning are critical to prevent pressure ulcers, especially in patients with limited mobility. Skin care, hygiene, and maintaining comfort are also key aspects of daily care. In addition, energy conservation techniques help patients manage fatigue by balancing activity with adequate rest, allowing them to maintain function for as long as possible. As the disease progresses, communication and nutritional needs require careful attention. Communication strategies must be adapted over time as speech becomes slower or difficult to understand. Patients may rely on alternative communication methods, including writing tools, communication boards, or electronic speech-generating devices. Emotional and psychological support is equally important as patients often experience anxiety, depression, and frustration due to loss of independence. Caregivers also face significant physical and emotional challenges, including stress and burnout. Access to counseling services, caregiver education, and support groups can greatly improve coping and long-term care outcomes. Complications in ALS are common and require proactive management. These include respiratory failure, aspiration pneumonia due to swallowing difficulties, malnutrition, dehydration, and pressure injuries. Early recognition and intervention are essential to reduce morbidity and improve comfort. Palliative care focuses on symptom relief, comfort, and maintaining dignity. Ultimately, ALS is a complex and life-altering condition that affects physical, emotional, and social well-being. But with coordinated multidisciplinary care and strong support systems, patients can maintain quality of life and dignity throughout the course of the disease.